I'm Associate Professor of Endovascular Neurological Surgery at New Jersey Medical School. We treat complex head and brain vascular disorders through minimal invasive approach, catheter-based approach. There are two ways to approach this, either through the groin arteries or through a very small hole in the arm through radial artery. We learned from our colleagues from cardiology that radial artery is much safer and very satisfactory way of doing these things. So at least in New Jersey Medical School, which is somewhat non-traditional for neuroendovascular side, that we focus heavily. In fact, 90 to 95% of our cases, we try to do through radial approach. Our approach is very patient-centered because not two patients are alike. For every patient, we have a multidisciplinary approach. We are fortunate enough to work with really talented, not only endovascular surgeons, but open surgeons. Sometimes that approach, endovascular approach, may not be a good fit for the patient. So for every patient, we talk amongst our colleagues, locally, sometimes nationally and internationally, and we talk with our fellows, with our residents and our students also. And then we come, what's the best approach for that patient? Here at Rutgers, New Jersey Medical School, we are fortunate enough to work with really like-minded people, and also we have an obligation to train our medical students, residents and fellows. We are heavily involved in research, which is clinical research, data collection, as well as one of my biggest passion is to bring new devices to the market. We are fortunate enough to collaborate with locally, nationally and internationally that we enroll patients for the trials, and we have access to these devices years before that they will come into the market. So in last 5-10 years, the technology has grown leaps and bounds. Just before, let's say 20 years ago, 30 years ago, and even 10-12 years ago, for treating brain and vascular disorders, most of the time the approach was to do an open surgery. The nature of the course of the disease was that you will end up staying in hospital days, if not weeks. With the advancement of technology and with minimal invasive approach, we can treat those disorders very safely through a very small hole in the arm, and most of these patients can go home next day. As we all know that in last 5 years or 6 years, the treatment has become a standard of care. For last 200 years, we didn't have any treatment for the most complex strokes. Fortunately now, we have that treatment. But now it's our responsibility to bring that treatment or bring awareness about that treatment to the general population. So we do a lot of community reach. I'm also partnership with the Society of Vascular Intervention, which have a program called Mission Thrombectomy. So we not only do local outreach, but we also do national and international outreach. So make people aware that there is a treatment. We can only provide treatment to the patients if they present to the hospital in a timely manner. We also involve our EMS services, and we do every 6 months or a year that we all sit down together and we tell them what the cases we have done and what is new coming in that technology. We also do some community fairs. So the word needs to get out that there is a treatment for most of these disorders, especially for complex strokes. So the future is very exciting. What we have seen in last 5 to 10 years, I think the field is going to at the cusp of exploding now, with robots probably coming into this field, with AI helping us and guiding the treatment paths for us. The 3D models and all of those things is going to make not only safer for the patient, but for the operator as well. So we are very excited to be in the field at this time.